This is video 5 of 5 in the ketamine-assisted psychotherapy process series. I like to think of integration as how to make use of your ketamine medicine experiences by making sense of the insights you've learned along the way, which ultimately translate into changes in your life. I'm going to break integration down into two parts for the purpose of this video: short-term integration and long-term integration. There is a special time frame, 24 to 48 hours immediately after your ketamine medicine experience, in which your brain is more flexible and available for growth and reorganization. In fact, this added brain flexibility may actually last up to a week or so. This is called brain plasticity. What this means for you is that there's an opportunity where we will work together on how to implement behavior changes in your life. Now, when I say changes, I mean small changes, not rash ones like quitting your job, leaving a relationship, etc. Slow your roll, even if you feel 100% sure. No need to be impulsive. We can talk through these things together, as there may still be some things to uncover as we unpack your experiences. Back to the small changes or behaviors that can add up over time and have a significant positive impact on your life. You and I will have already collaborated on these things during our preparation sessions, so you'll already have an idea on what to do next. The following are some examples previous clients have focused on immediately after the ketamine medicine sessions: journaling, digital device detox, meditation, physical movement, especially in nature, creating some form of art. For some people, these small incremental changes turn into big changes. Integrating these experiences may take days, weeks, months, or even years. Give yourself time and be gentle with yourself. Maybe after your sessions, you'll find the motivation to make changes. I strongly advise people to focus on manageable changes that can be done with minimal barriers to get started. Just 1% improvement each day adds up. Rather than go into specific behaviors like I just did in the short-term section, which of course these examples could translate into long-term practices, I'm going to offer up some themes that may be useful when considering an ongoing integration practice. You may discover that your ketamine experience has allowed for a deeper connection with parts of yourself, which then allows for deeper connections with things outside of yourself. These connections might be with other people or nature, or maybe you have some other activity or hobby that may have been part of your life in the past that has been put on hold for whatever reason. After your ketamine experience, you might find the motivation to experiment with different creative outlets. For one person, it may be creative in the traditional sense of writing, painting, making music. For others, it may be tinkering around with something or discovering a new innovation. I believe that everyone can be creative in their own way. For some, this may mean living and practicing more spirituality in life. For others, it could be doing more service work for other humans, animals, or the planet. You get to decide on whatever is most meaningful to you. Before you go, I'm creating an integration workbook. This one's specifically for people in addiction recovery. It's launching early in 2022. For a link, please check in the description of this video.